Real talk with verified wellness providers. The Wellness Connection. Brandi, welcome to the Wellness Connection. Thank you so much for joining us. This is our opportunity to get to know some of our Arkansas providers, and we're really glad that you joined the Arkansas Wellness Network. Welcome.
Thank you so much for having me, Tanya. I'm really excited to be here and share a little bit about what I do in the brain injury field. It's one of those fields that people really don't talk much about.
No, before knowing you, I didn't know that there were whole departments just for this. I mean, it makes sense, but I didn't know that.
It
So,
does, given the amount of TBIs and brain injury, well, TBIs being traumatic brain injuries for those who don't know, and brain injuries that are out there. It's actually astonishing once you start looking into it.
yeah. So, to give a little bit of background before we jump into what you do, you and I met when we were in getting our master's degree. I was focused, we were both in the same department, but my focus was a little different. Mine was on the human performance, the health and the human performance, and yours was on health education, if I remember right.
Yes, that is correct. And I tell you, I loved when we were in school together. We did have some overlapping classes. I specifically remember statistics we had together,
Ooh,
and we
that
made
was
it
my
through.
least favorite class, and you were such a rock star. If it weren't for you, I don't think I would have passed that class.
Well, and to be honest, I was surprised I liked it at all. I figured I was going to do terrible. But I think my favorite classes actually revolved around substance abuse and mental health and actually how to present education.
Yeah. And that's a big part of what you get to do now in your professional world. Um, and I have the pleasure of being able to work with you. I'm so grateful to you for helping reinvent ourselves, get into that field. So we do a program where I come in and work with your brain injury survivors, and I love that.
Yes, you do, and, actually, you've been a phenomenal help to us, and I
Oh,
really appreciate that you for that. You are one of those people that when you're going to join us for an event or a, show or a book club or whatever, they get really excited about. They know that you understand them, they know that you relate, they talk very highly of you, but yes, you have been instrumental in things like our book club, which you help facilitate, and the emotions that you see coming from the survivors is it makes you emotional. It makes you really feel like you are understanding them on a whole different level.
yeah, yeah. There's some great people out there that I really enjoy working with, and I appreciate that. So tell us more about like how you got into this field and why, and give us your background.
So, actually, when I was a little girl, I used to run around screaming, "I want to cut open brains. I am going to operate on brains." I mean, as little as
Really?
like 5 years old, my grandma used to say, "There is something wrong with you, child," and I was like, "No, I'm going to be a doctor. I'm going to be a doctor who operates on brains." And as I got older, I was always fascinated by the brain. I can remember winning my fifth grade state science fair competition, and it was left brain versus right brain. And I actually found like a year ago when I was cleaning up my notebook that had to be this thick from that competition in fifth grade because I was so serious about this.
Oh, that is so
And
you too.
oh, it is. And so as I got older, I continued to read. Even if it didn't have something to do with what I was doing, I would look at the brain articles and read, and I would study the brain. And honestly, I was intended to go on and become a neurosurgeon. That is the path I was headed on in school before I met you. I was actually going the medical field path. And due
Really?
to life situations that happened, I got pulled in a different path. And that's actually the only reason you and I met because we would not have met. It just happened to be that I decided, okay, if I cannot become a neurosurgeon, I would find a way to bring information to help people in some way, bring health education. Now, as far as how I got into TBIs, that's even like more far fetched. I was working in another department and I decided, I would like to do something else. This is not my biggest interest. And there happened to be a spot open in a portion of the place I work at that has brain injury. And I interviewed, and I remember finding out not only was it brain injury, it was a remote position, like fully remote. And I was like, oh, well, this is a dream come true. And so I have been there for the past few years. And I love it. I absolutely love it. I cannot see myself working outside of the brain injury field ever again.
And you are phenomenal at what you do, bringing people together, bringing in resources, most people wouldn't think to bring into that department. And the like what you said about me, your survivors, the people that have had TBIs, they look at you the same way. I mean, you are like a lifeline to some of these people, literally like a lifeline. Some of them are so depressed and they feel so isolated and alone, and no one understands what they're going through. And you bring them together with the specialists that they need, but you also bring them together with support groups and many other different resources. It's amazing to watch what you do. I'm so proud of you.
I really appreciate that. I'm proud of you as well. And actually, one of our teachers I saw the other day, who's now going to be part of what I do, is also proud of both of us. Bringing these resources to them, I've always been an outside the box thinker. I don't know how to explain it. It's just I see something and I figure there's a solution somewhere, no matter what we have to do. And it is really important that brain injury survivors have community. It is the number one difference in their recovery journey, their healing journey, that makes the difference. Because you're right. No matter what happened, no matter what the incident was, no matter where they're at, they all have suffered depression, especially in that beginning time. And that is when
Yes.
they really need community. And now we're really working to make sure we get them right up front. When they're in the hospital, we start getting them resources and community then. I recently met a lady who joined a support group who said, 17 years, I did not know anything was out there for me. This is the first time I've really felt not alone. I have
Yes.
another survivor who has told me multiple times this group has saved her life. And she was so glad that I continued to just invite her and welcome her and come on, you can be part of the group. And it does feel like a family. And one thing
Mhm.
about brain injury survivors, I don't know if it's the injury itself or just who they are. They are the most kind, most welcoming, most loving group of people. They are completely accepting. I can have the worst day of my life and then join a support group and I'm instantly uplifted by them. Their spirit
Yes.
is amazing, and they all have this journey that you hear, and you are just astonished that they can have this attitude after what they've been through. And I mean, some of these stories are things like I had a 2% chance of living. My school was exposed. I wasn't going to make it through the night. I had to learn to walk and talk again. Now I have my PhD. I mean, it is absolutely awe inspiring what they do.
It really is. I have been amazed by some of the people I've met. You know, I come from the veteran background and we have TBIs. But I've met through you, I've met people that have suffered gunshot wounds, horrendous car accidents where they're in a coma for
Mhm.
extended periods of time, rehab for years. And I had just never been exposed to that, and I'm so grateful to learn from them, and it's amazing. One part of the brain might be broken, but the other part works really well. And you have actually even gotten people from other states. Like we're here in Arkansas, you're an Arkansas provider. And you provide, my understanding, you provide services throughout the state, no matter where you are. If you have a brain injury, they can come to your program.
Yes.
Um, but you also have had people from as far away as Alaska join the support groups.
Yes. So, one thing that is fantastic about the brain injury world, there's no gatekeeping. We come together underneath a large group of people and we meet as states. We will have an actual conference this year
Yeah.
where everybody from across the nation that's interested in brain injury will come and join and speak together. And so when I am contacted about people in other states, such as Alaska, who unfortunately have brain injury resources, but it may not be quite what the person needs or not enough to be able to accommodate their needs. I I was asked, "Can I join this book club? Can I join this support group?" Well, yeah, why not? It's not gonna hurt anything. It's virtual, it's free. Everything we do is free. We're just there to help people. And you're right, our reach is the entire state. Um, We do this through, education as well. I
Mhm.
just created some modules as well, so it's not just about support groups and things like that. I do trainings. I train police officers. For the first time ever, we're actually saying, "Hey, this is what it looks like to have a brain injury." And we are looking at schools and training nurses and making sure that we get those children who have been missed, who may have had a concussion that maybe it just didn't seem like it, but it's still affecting their lives and so on. And I mean, there's so much work to be done in this field. I could talk about the things that we do and the things we need for days.
Well, and I'm excuse me, I'm glad you brought that up because one of the things that I've learned from working with you and with the survivors is several of them never knew. They were misdiagnosed and did not know that they had a brain injury. Can you talk a little bit about how do they get diagnosed? How do they know they have a brain injury? And where do they go once they figure that out?
Yeah, so I think some of them are more obvious than others when we say gunshot, to the
Yeah.
head, or we say, severe car accident, went to the hospital. Those are your, like, obvious ones. Those are the ones that
Although
they
you say that they're obvious, we have seen some of the cases where even though it was something very severe and they should have been checked out for a TBI, they weren't.
No, you're correct. You're absolutely correct. You're right. It is something that should have been pretty glaring considering, their head was obviously injured, but it is missed sometimes in that area. In a lot of areas where it's missed, I hate to say this, is domestic violence. And we
Yes.
work with the women in one of the jails right now, and we provide what's called an OBIS, which stands for Online Brain Injury Screening and Support System. Now, it's not a diagnostic tool at all; it is an assessment tool, and we give this to people. As a matter of fact, one of our people will be at the Arkadelphia Health Fair that is happening this weekend, giving free brain screenings. And so, what astonished me was we went into this jail and we said, "Hey, 20 women, do you have a brain injury?" 20 women said no. 20 obuses later, we told them, "You likely do." And that was amazing to me. And then we start hearing stories about, well, I was held captive for 30 days and pistol whipped every day. And you're going, oh my gosh.
Wow.
Or, yeah, a horse kicked me in the head. And then, or I was strangled unconscious X amount of times. And that one's really missed a lot. That one is the one that you have to listen for when somebody is strangled, when that oxygen is cut off. And a lot of times that is during one of those situations. Now, does it have to be domestic violence? No, it doesn't. There are other issues. You could be elderly and have a fall. And a lot of people think, well, elderly fall all the time. Well, what if 2 weeks later, there's obviously something wrong? They're acting out of character. They've acted like they've just forgotten who they are. They're showing signs of sudden dementia and Alzheimer's. It's likely it's probably a slow bleed that is formed from one of those falls. Children, of course, children, what are they doing? They run around all the time on the playground, everything else. A lot of times people say, just a concussion, just a bump. I want to say this loud and clear. Yes, it may be just a concussion, but if the rules, or not the rules, but the doctor's orders and your healthcare team are not listened to, the next thing you know, it can go from just a little bump, just a little concussion, into you are disabled for the rest of your life. You are paralyzed in an actual wheelchair, unable to eat,
Wow.
unable to feed yourself, unable to go to the bathroom by yourself. So please really listen to those precautions, listen to those orders, and even if you go back and everything looks fine and you still feel off, take a little bit more time because I think everybody would rather take a little bit more time to heal than have to put in a whole lot more time or find out that unfortunately the damage is unable to be undone at this time.
Yeah, sometimes it's irreversible, yeah.
Mhm.
We've seen some wonderful survival stories, though. I can think of one specific, and I can mention him because he's actually done one of our podcasts,
Yeah.
Keith.
Yeah.
Keith is so amazing, and
Yes.
his story is phenomenal. He's a great picture of survival
Yeah.
and beating the odds. I think he said he had a 10% chance of even living, and even with that 10% chance, it was like 1% chance that he would, be able be basically functioning,
Yeah.
living on his own, and now he is thriving. He's doing
Yeah.
amazing, and that's awesome. I'm really glad. Um, so you mentioned domestic violence. That is another project that you and I are very passionate about and
Sure.
both working towards, and I'm really excited about that. But one of the things that struck me that you taught me about was the prevalence in Arkansas, both TBI and domestic violence.
Mhm. Yeah, so, as I think most people maybe know, domestic violence goes unreported, right? It's one of those things that
Mm.
people really don't want to step up, especially if it's a man that's been abused, right? That's even more
Mm.
likely to go unreported. However, it's 1 in 4 men and 1 in 3 women who have suffered some type of domestic violence incident, whether it be one time or multiple times in their life. And it's just not Arkansas, it's nationwide. And of that, there are some studies report that they believe that actually 100% of domestic violence incidents or survivors have suffered a brain injury at some point. Now, compare
Wow.
that to the average population, general population walking around, right? 8 to 9%, 100%. We're talking 100% of a particular subpopulation may have a brain injury. When we look at people in jails, right? It's anywhere from 25 to 87%. Notice how much higher that is as well. And the question comes up to well, are they in jail because their TBI caused abnormal behavior or what? Come to find out that people who have moderate to severe brain injury within 5 years, if they've never had any trouble with the law at all, 31% of them end up in jail or prison over a major offense. And to me, that
Wow.
shows a correlation. Yes, there's absolutely a correlation.
That is interesting. I need to put
Mhm.
you in touch with another lady I work with who specializes in working with the prison population. That would be a really interesting
Yeah,
conversation to have together. Um, that's wow. I
yeah.
am
That's how
kind
I
of
feel every time I hear one of these percentages or one of these stats. I just go, wow, wow. I mean, there's no why isn't there more talk about it? When we're talking about 100% of subpopulations, 87% of subpopulations. Wow. Why is this
yeah.
not in the news? Why is this not bigger?
So one of the things you do that I am always impressed with, and it's exciting. You always invite me, and I'm really grateful. You do a lot of events, and a lot of work goes on behind the
Mhm.
scenes, and it's kind of a thankless job, but you have a really you have a couple of big ones coming up. You've got the spring awareness. And speaking of, March is
Mhm.
Brain Injury Awareness Month, and, you've written a couple of articles. We're so grateful, and
Yeah.
we're so thankful to have you as part of the Arkansas Wellness Network to help educate us on, brain injury, brain health, and health in general, because
Mhm.
while you currently work in the brain injury field, you're a health educator, and
Mhm.
we very much appreciate you for that. Um but tell us about the events that are coming up.
Yeah. So, first of all, I really do thank you for allowing me to be part of this network. It has been fantastic to learn and see who else is out there and some specialties and stuff I didn't even know about. And they will come in handy in what I do as well. And you are right. I am specialized in all kinds of other things as well. Once you're a
Mhm.
health educator, you have just a plethora of things that you learn and you delve into and you can talk on. But as far as the events that are coming up in March, we have our Survivors Day. Now, that is a day that we educate and celebrate our actual survivors. Our program puts it on yearly. It is free, of course. It's for survivors, caregivers, sometimes professionals in the field will join us. And we have speakers related to their needs. And this year, we're also like playing brain injury bingo, and they're going to draw their own TBI so that they can, express how this actually means to them. It's one of our best events every year because you spend the whole day working with the survivors. And you've been part of that before, and we are so grateful you've joined us for that. And then our biggest thing, normally we have an annual trauma symposium. And yes, I do that one. But instead, this year, we submitted a proposal, and instead, this year, NASHA, which are the I'm going to butcher the actually what it is because I don't have it right in front of me, but essentially they're the state head people over brain injury for the nation, and administrators that they have an annual conference called State of the States, SOS, and they gather people from all the states that want to participate, professionals, and we have a 4 or 5 day conference. Now, last year I was lucky enough to attend in Maine, and there was a cruise and there was fun activities, and you really spend the week not just getting to learn, getting to network. So, like I said,
Mhm.
I'm co-chair this year. I'm very proud to be helping with this event, and we have several pathways if somebody's interested. You can join the criminal legal track. You can join forever. The brand new track is the clinical track. So we actually have a clinical track where you start looking at that clinical portion of brain injury because it is there. You do have to know it. While I'm focused more on community, without the clinical portion, you just
Uh-huh.
can't help anyways. You have to have that diagnosis and you have to have those best practices. We also have the mental health and behavioral health because one thing that we know about brain injury, it doesn't just affect one thing. A lot of people think it's the or a mental health issue. It's not. It's not at all. It's a physical thing that actually happens to your brain. Like you said, that impact earlier, whether it's to one lobe, multiple lobes, so on, that impacts the rest of your life in various ways. Physically, I know for sure there's one survivor. She limps, but she doesn't have a physical reason for a limp. She limps because her brain tells her to. And that to me is amazing, right?
Mhm.
Then you have your behavioral and stuff, and they get impulsive and they have mood swings and stuff, and they don't even realize they're doing it, you know? And so then the final track is long term services and support because that is important. What do you do to help them in the long term? You can't just say, okay, great, we've put a band aid on the issue for now. I'm glad you're feeling better. Go off on your own and take care. No, it's a chronic condition that has been deemed a chronic condition by Medicaid. They need lifelong support. They do.
Yeah. Yeah, and family support too. It
Yeah.
affects the whole family, friends, everyone. And there's different severities. I have a brain injury. Mine affects my vision.
Mm,
I'm completely blind over on this side, in both eyes. And it's very interesting to me when I meet different survivors. It's an invisible injury unless there's a scar. It's an invisible injury, nobody knows you have it, and it can be so different. Every survivor I've met has different symptoms, and, it affects them in different ways, but the one thing that I have seen is a lot of depression,
mhm.
a lot of isolation, a
Yes.
lot of people not understanding why they're acting the way they're acting or doing the
Mhm.
things that they're doing, and it's, very frustrating, and in one of the book club meetings that we had, the topic of suicide came up,
They did.
and we were reading a chapter where somebody who survived a brain injury discussed that they felt very depressed and that they considered suicide,
Yes.
um, and what we saw was that almost everybody in the group had felt that way at some point,
Yes.
and so I'm so grateful, so very grateful for the work that you do.
Yeah, actually, that was one of those, awakening moments because in my time, few years, like I said, in this and also studying the brain my entire life, suicide just wasn't talked about, and I don't know if it's because they were so afraid to bring it up because they thought maybe they were the only ones, maybe it's shame, I'm not sure. When that came up in that group and I saw everybody doing that head nod, and then
Mhm.
that conversation started about, "Oh, yeah, I felt that way at this time, and I felt that way at this time." I looked into it and I started going, "Okay, what are the other states do?" Because again, we don't gatekeep in the brain world. We don't do that, and there's really one state that's really starting to ramp up like a, awareness about it. And other than that, I don't see much. It might be a little bit here or there. So, what I've committed to doing is we are going to start doing some type of awareness, flyers, education, just talking about it so it does get out there because that way we remove that like a stigma about it. And
Yeah.
maybe then they will talk about it. And I'm very grateful to that book bringing up that topic because I would have never thought about it. And I think you mentioned caregivers a little earlier as well, and I wanna say to them, yes, we see you, we know you need help. We know that there is caregiver burnout, there is so much going on. today is actually National Caregiver Day.
Oh,
So I would like to thank all those caregivers out there who spend endless hours taking care of individuals, TBI or otherwise. One thing I do want other caregivers to know is I thought that the burnout would be from all the physical stuff you have to do, right? Like you're constantly
right.
having to help them physically. It's not. It's the
It's the
mental burnout.
emotional.
It's the mental and the emotional and the overwhelmed feeling and the exhausted and the you're right. They have mood swings and they sometimes take it out on their caregiver. And these are people that they may have been married to for 20 or 30 years. And now they're trying to, roles may have suddenly switched. This person may have been the main finance person in the house and now they're at home and this person's suddenly working while also trying to care for them and it can cause such stress. I mean, in the moment that that TBI survivor's life changes, so does that caregiver. And
Yeah.
it's often also overlooked. And I just really appreciate them because we couldn't do it without them. We can't do it. We cannot be the only ones out there. You're the one closest to your survivor and you love them and you want what's best for them.
So, I'm glad that you brought that up, and I didn't realize it was National Caregiver Day. The caregivers, that is a really hard job. Like you mentioned, it's not just the physical. The person may have a lot of physical needs, but the emotional,
Hmm.
the wear and tear, it is exhausting to
Hmm.
have to take care of somebody 24 hours a day, and then the person who's being taken care of feels like a burden. It's
Yes.
such a cycle, it's a really difficult thing to navigate.
Mhm. It is, and, one thing that's desperately needed is respite care, and we have been looking into this for 2 years,
Mm.
and we haven't found it, like, we don't know how to get them respite care.
Oh,
If
wow,
anybody
yeah.
listening to this can help get TBI caregivers respite care in Arkansas, please, please help me, please reach out, contact me. I want to desperately help them, they need it. You gotta think about too, what if they have health crises? Then where are we
Oh,
at, right? Because a lot of our caregivers are also already having physical and mental and, diseases and conditions, and they're just having to put their stuff aside. I mean, and that they may have gone from being the one who was mostly being taken care of, maybe they didn't need full caregiving, but now they're the full caregiver, and that can be in itself so stressful. And
wow.
you do see a lot of times, um, people will leave because they can't handle it. And it's sad when it happens, but it's also understandable. And so we need to give them as much support as we can, as much love as we can, and we need to give them respite care.
Wow, that's I had never thought about that. I was a foster care parent, and I used to do the respite care.
Yeah.
And I had never thought about that for adults, but you're
Adults,
right.
exactly. Adults, and what do you do? Do you, one thing we talked about was, well, what about one of some of the more, like you said, there are different severities. Well, some of the more capable, TBI survivors, do we have like a group where they can meet and the caregivers can go do what they need to do, or they can sit and we can hang out with them and maybe the caregivers just go in another room and make those phone calls they need to make, take care of that
Yeah,
insurance bill, take care of paying the bill. Just sit there for a minute and breathe. Like, what do we
right.
do? How can we help? And so again, I will put that plea out there of if anybody knows how to help with respite care, in brain injury world, please let me know. And remember, we're talking about a world that is nonprofit, that is not we don't have those sources and those funds to pay for it. So before you reach out, keep that in mind.
And that's one thing that we're trying to build with the Arkansas Wellness Network is that network where we have the different resources. Recently, I interviewed Dr. Cam, and Dr. Cam specializes in some of the things like vertigo that we hear from several
Mhm.
of our brain injury survivors. And so that's one of the desires for the network is to help locate those missing pieces. And one person may know of something that the other person doesn't know anything about. And then we can all work together to help each other. And so maybe within our network, we have somebody that specializes in that. Maybe there's a nonprofit out there somewhere that helps with things like that. So yeah, maybe somebody will be watching this podcast and they'll know. And we can also put it in the magazine. We're
Yeah.
going to focus the magazine. You've written a couple of articles. I'm so excited. But the March edition of our magazine, Arkansas Wellness, is going to focus on Brain Injury
Yes.
Awareness Month. And so maybe we can kind of put a little advertisement in there that there's a need for
Yeah.
respite care.
There is a need. We can put a call out there for it. Also, I'd like to take this moment to thank our Brain Injury Association of Arkansas. For those of you who don't know about it, the president actually is the one. Normally, our area does, but this year we had some staff changes, and so they actually put in for the governor to recognize March as Brain Injury Awareness Month, and of course, that proclamation will be signed and ready to go by March. It always is. We're so grateful for that.
That's wonderful. Yeah.
And yeah, it is fantastic. So I am very thankful that that is recognized.
Yeah, and the Brain Injury Awareness, Association of Arkansas, they do a lot of support groups and
Mhm.
different activities and events. I think you said that they have one coming up in the fall?
Yeah, so one thing that we noticed is we do fantastic at Spring Survivors Day here in Central Little Rock in Arkansas, right? But what about our Northwest people? What about
You
people in
know,
the coastal
I
states?
see that a lot, and that is part of the reason for the
Yeah.
network. We focus because of the way Arkansas is laid out, we focus a lot on Central Arkansas.
Mhm.
It's where our heavier populations
Yep.
are. It's also in the middle, so it's
Mhm.
easier for everyone to get to, and those outlying areas kinda get left out. We've seen that with some of the survivors.
Oh, yeah.
They're
Oh, yeah.
the services that they need, they can't get because they're further away. So I love that, that they're doing that and in Northwest Arkansas, and that's think one of the things going forward that the Arkansas Wellness Network wants to do is try to vary where we host things and
Mhm.
try to get out more into those communities that tend to get a little bit, neglected.
Yeah, and I love that, and I am grateful that we have technology, so we can do those
Mm.
virtual support groups that sources, which is sources for community living, and they are in Northwest Arkansas, and they will also help with that event. It'll be like a fall Survivors Day in that area, so those people can attend in person. But I am grateful we can do those online support groups, online book clubs, but also too, there are people who need in person. They need that physical like association with somebody, spending time with them, and so on. And so I'm also grateful for those support groups that are in person. However, you're right. If it's one of these small outlying areas and one or two people have a TBI, how do you sustain a support group? Well, one, there's probably more people with the TBI in the
But
area
they
that
don't
just
know,
doesn't know it,
yeah.
just don't know. And then also, too, you find people, you find champions. That's what we call them. We find people who are champions. You are a champion in domestic violence for us, right? Because I said, hey, we don't have anything in the works for domestic violence yet. 100% of those populations, perhaps. And you were elected as the chair of the Domestic Violence, Intimate Personal Violence, TBI subcommittee. And I say subcommittee because it falls under the Arkansas Brain Injury Council. And we are so grateful for that.
Yeah, yeah. All right. Well, thank you, Brandy, so much for joining us.
Yes.
We are so grateful to you and all the work that you're doing. Tell us really quick if someone has a brain injury, how do they get in touch with you or the program that they're working or that you're working with or anything like that? How do they get more information?
Yeah, so if they're seeing it through you, they can, of course, reach out to you because you know me personally. Otherwise, you can always just Google brain injury program, and UMS will come up first, of course. My information is on there. You can also email me at B, as in Brandy, Dawson, Dawson, at UMS.edu if you need to reach me in a capacity of that job. Today, I'm here as a network person. And so, of course, if you want to get through to me at the Arkansas Network Wellness I'm sorry, Arkansas Wellness Network. I said that backwards. I'm on there as well. And so today I'm acting in that capacity. You can reach out to me that way as well.
Yeah, we're really grateful and glad to have you. Thank you
Yeah,
so much, Brandy. Have an amazing day, everyone, and we'll see you on another episode where you get to meet other providers.
great. Thank you so much for having me. Take care.
Bye bye.
Bye.
The Arkansas Wellness Network and the Wellness Connection are an initiative of reinventing ourselves, a 501c3 nonprofit promoting health, happiness, and hope.